So before Dale share his experience with the audience, and thank you Dale for showing the full face and share the experience. But I'm gonna show the audience what Dale looked like before to get you an idea that he, although he had some beard, mostly goatee, but he can't grow a full beard because he's mostly a little patch here and there, and his sideburns weakened. So we connect that and we follow the natural contour of it, and then look at that. And you can see it can be very dense, so that's why he's before, and he had difficulty growing his beard, and now that's where he is again. So, and the audience want to know what's it look like surgery day and doing the recovery, when the pain go away, when the redness go away, when the scab go away, and when you have full set of beard and all stuff. So, go ahead, Dale.
Well, I've always been self-conscious about the hair on my cheeks, so when I got to the point where I had some disposable income, I started researching hair and beard implants. And I looked at doctors all over the West Coast and found one that was highly recommended and did exactly what I wanted locally, and they're in Los Gatos. So the day of the procedure, my wife came in with me, dropped me off. She knew what was happening. Procedure was painless. Actually, I slept through most of it, so that was really easy. After the implants were done late in the afternoon, I was shown, and my wife was shown, how to keep the implants clean and how to kind of dress them every day, and also where the hair was taken from the back of my head. That was needed to be cleaned and looked after each day. So my wife got that job. The daily routine was you would wash it and then dress it. When I came home from the implant today, there was no pain at all. Partially because the adrenaline, and partially because probably the medication. But after a day or two, the skin in the back of my head did become sensitive. I had to be really careful how I slept, because since the hair was removed from the back of my head, that was sensitive. And of course, the cheeks with the new roots in them were sensitive. So I had to prop up my neck in pillows when I slept, and make sure I didn't roll over in the middle of the night and rip anything apart, which I didn't.
That's pretty difficult.
Yeah, there was a couple of nights where I woke up on the side of my face and go, geez, I rip it all out, and no, I didn't come out. But I was certainly, certainly hoping I wouldn't do that, didn't rip anything out. Even during the cleansing process, I didn't know how strong the new roots would be. Mm-hmm. And they ended up being fairly strong. They put up with a scrubbing way to keep it clean, prevent infection. So that the uncomfortableness lasted about 2 weeks, and that was the same for the redness. Mm-hmm. So as the scab started to dry and form over, that began in about 2 weeks. So it was about the same time the redness went away, and the sensitivity or the pain kind of went away. It wasn't that bad. It was just uncomfortable. It kind of itched, but you don't want to itch it because it's new growth. And once it scabbed up, the scabs became dry. It itched a little bit more then, so you have to keep your hands to yourself. You can't, even though you want to scratch it. But once the scabs dried, they fell off on their own. They fell off during the cleaning process, and they just fell off while sleeping or on their own. Mm-hmm. So by about the 3rd week, the scabs were gone, and the hair was. You can see the hair to where it was gone, and the redness around each hair had really lightened up to the point you really couldn't tell the redness anymore.
So around 3 or 4 weeks,
yeah,
pretty much the redness disappeared, right?
Yeah, the redness was, for me, it was
3 weeks.
It was gone 2 to 3 weeks.
2 weeks.
Yeah,
okay.
so it was pretty good.
Uh-huh.
The next phase, and again, my wife's cleaning this every day, and we're dressing it, and the next phase occurred over 1 to 2 months. Is some of the hair breaks off and falls off. So you go through a thinning period where everything lightens up. Don't worry about that. I didn't, and I'm glad I did. After about 4 months, the hair that fell off, it starts growing back, and it grows back probably a little denser, a little thicker than it was before. By 6 months, this is pretty much what I had at 6 to 7 months. Is it totally filled in? At that point, there was up to that point, touching the skin, it was sensitive.
Okay.
You could feel, you could feel something's been done with it. Just under the skin, sensitive. By 6 to 7 months, that sensitivity of the cheeks are all gone. Where the hair was transplanted from in the back of my head, that stayed sensitive till about 7 months. But I could brush my hair, I could wash it. I just knew it was there, but it was no big issue. I could sleep on it. I was able to sleep on the back of my head after 6 weeks, 5 weeks. So it was kind of smooth sailing after about that 2-month period. It's just wait, and it takes care of itself. So I'm glad I did it. Like I said at the beginning, I was self-conscious. I had the disposable income. The price was not outrageous, not prohibitive. So it all worked out great. So I volunteered to do this video because I'm very pleased with the results.
Thank you. Yeah, and the audience certainly appreciate, because a lot of times they're nervous of when can they go back to work when people seeing them, and would it look abnormal when the hair started going back out, right? And so and Dale was mentioning it's exactly what you mentioned to me. So you're gonna have some swollen, and then after that you're gonna have some scabbing, and the scab will fall off on average around 2 to 3 weeks. The redness now, it varies from some individual to another, but on average 2 to 3 weeks, that's when the redness will disappear. Some people who have a histamine positive skin, it might last a little bit longer, but not everybody. Majority of the time, people are gonna disappear the redness and the scab again by 2 weeks. So on average, people take around 2 weeks off from work, if not up to 4 weeks, if you worry about it, and then the leaf part of the tree will fall off. That means the hair will fall off. That's a shedding phase. So you go back to as if you never have had surgery. And it's a scary time, because a lot of people say, "Oh my gosh, did I waste all my money? The hair didn't grow out." But that's how the life cycle of the hair is. We can't control that. However, what we can control is how natural and how dense it will grow back out. And around 4 or 6 months, the hair will begin to go back out. And then a year's time, you have full density. And it's your real hair. You can cut it, you can perm it. Yep. Now you look like the Anthony Hopkins, as I mentioned many.
Well, the hair on the beard now grows as fast as the hair of my head. So it's of course you could style it and make all different different beard cuts with it. Sure. Right now I'm just letting it grow out a little bit just to see what other effects it'll have. I do want to mention that I did return to work after 3 weeks. Okay. The swelling was all gone, the redness was all gone. So then I was concerned whether the people at work would say, "Oh yeah," if it was really obvious, and if they would kind of make fun of me. And actually no one really noticed. They noticed, but they didn't notice. They didn't know what it was. So I got through that phase with no problem, where I was kind of nervous.
So when the hair started to regrow back around 4 to 6 months, it didn't look abnormal, right? I mean, because a lot of people worry about that stage, that ugly duckling stage where the hairs, not all of them grow back out, right? No,
it filled very evenly. Some of the hair grew faster than other hairs.
Right.
So I would just trim them to keep them the same length, and it looked really very natural. So I could trim this back probably to half of what it is right now, and it would fall and would blend very nicely.
Great.
So I'm very, very happy with the ability to have different styles. What I've done is I've grown it out kind of to match my goatee, so it's kind of all the same level. But it turned out great.
Thank you, Dale, for allowing me to show the audience what he looked like before, and to share the experience with the audience. And hopefully the audience will get a glimpse and understanding of what they will expect to go through from surgery on the surgery day and doing the recovery. But again, not everybody gonna heal exactly the same, but at least this gonna give you a little glimpse into what you should be expecting. Thank you. All right.